Thanks to Charlie and Marianne and all the trustees of the Health Trust that are here this morning. I want to also take a minute to thank Dr. Liz Velardo, who's here from the Palo Alto Medical Foundation. Liz will be introducing our keynote speaker. I also want to just take a personal moment to thank Dr. Gerberding for coming. She was here on a conference this week in San Francisco, and so we scheduled her to be here for today when she was at that conference, and she had to return to Philadelphia this week. And then she flew back yesterday just to be with us this morning. She'll be flying out this afternoon. And so I'm personally just so touched at her support of the Health Trust, and I'm delighted that we'll be able to share her, she'll be able to share her thoughts with us this morning. And I just want to say thank you to everyone for coming today. It's really good to see all our friends and welcome the San Jose leadership class that's joining us this morning. Many old friends, but also some new friends in the room. And so welcome to all of you, and thank you for being here. This morning, I want to begin with the words of Cesar Chavez, whose homeland we actually speak on today. He writes, "Talk is cheap. It's the way we organize and use our lives every day that gives us what we believe in." Today, my goal is to talk to you about what we believe and what we're committed to getting done in the next 5 years. First, we're committed to our staff. Best looking staff in the county. And the programs that they so brilliantly run, such as our aid services, our dining out for our destination home, our Meals on Wheels, our family resource centers, our health insurance enrollment, our wellness services staff, and so many more. We're committed to their wellness as well as we literally walk the walk to model healthy work environments in our community. We're also committed to continue our investments in the myriad of community-based organizations that we work so closely with. We could not do our work without these nonprofits and so many more that work together with us at achieving improving health in this community. Together, my staff and the staffs of these nonprofits really represent the definition for me of generosity. They serve this community, never expecting anything in return, ever. Their model of generosity is the success factor, the key success factor of how we achieve the great things that we've done. While we believe in our current work and we feel it's not time to stop or quit or even just congratulate ourselves, it is time to take it to the next level through innovation, visionary thinking, and a lot of hard work. You know, in my 6 years at the Health Trust, I've come to see that there's kind of a Health Trust way. Our thinking may not be totally unique, but it is distinctive in our approach to the challenges, I think in at least 3 ways. First, we're not afraid to take on tough issues. We don't take on every tough issue. We only take on those that we feel our engagement can make a real difference. And there's probably no greater example of this than our work on fluoride. So, I was fluoridating kids' teeth a really long time ago. This picture is the class of 82, 83, and this was not my first preschool class. So it wasn't a stretch for me when I came to the Health Trust, and we said, San Jose being the largest city in the country without fluoride was a moniker that we wanted to lose, especially because it had inequitable effects on the health of particular communities and especially children. The Health Trust way is to use our resources, coalition building, expertise, advocacy relations, and partners to fight the challenge. And in this case, we're winning, with Santa Clara Valley Water District voting to fluoridate their system. We pledge in the next 5 years to continue the fight to fluoridate San Jose for as long as it takes. But our goal is to complete this in the next 5 years. Second, we believe in the dignity of all persons, especially the vulnerable in our community. It's a pretty low bar if the goal is to only make the healthy healthier. When we say everyone, we mean the most challenging, the most susceptible to poor health, those with the least access to resources needed to improve their health. The elderly Meals on Wheels client, or the homeless, the chronically homeless person or couple or family, people living with HIV and AIDS, the isolated senior, the food-deprived family. And third, we believe that we have a stewardship responsibility to use our resources strategically, wisely, and effectively to maintain the trust that we have earned from the community. As we look at the next 5 years, we are faced with this ever-widening income gap. We live in one of the wealthiest areas in the world, and yet we have a growing poverty rate. We need to become uncomfortable with this tale of two cities reality. It is too easy for all of us to live in privilege here. Privilege when you have the luxury of not having to think about something or have it affect you. So let's look at these next 5 years and see what we are hoping to accomplish. First, I want to talk about seniors. Why do we struggle with this sector? From a lack of funding to a few elected officials wanting to champion this arena to weak media coverage, I want to proffer one possible reason. We have an age bias in this valley, and indeed the entire country. Our society views youth as our future, representing energy, vitality, possibilities. We take pride in recently being named one of the top regions drawing more young workers to us. When we look at the downtown San Jose or any of our downtowns, we say the goal is to make this a happening place for young people. You don't look your age. You look good for your age. The best compliment is when someone finds out your age and they're shocked because they think you were younger. The media gives us a skewed view of this golden age, with false impressions of how we're supposed to look in these great retirement years. Compare this to more traditional cultures where age is a sign of wisdom and the first duty of young people is to care for their elders. We need to come to grips with the facts of the silver tsunami that's hitting our Silicon Valley neighborhoods. I'd like to say at the Health Trust, we take aging personally because I think we can all relate to an older people in our lives who have profoundly affected us when they were older. For me, one of those people is my grandfather, Santiago. His humor, kindness, and gentle spirit influences my thinking about aging. But one common theme that I think most people can relate to is this concept of home, coming home, being at home, bring them home. Home is where the heart is. And as you age, most people want to stay in their homes. Why? Because of all it represents: independence, familiarity, dignity, security, and connection. At the Health Trust, we believe that as a community, we should make that option possible for as many as we can. And it should not be the option only for the very wealthy. But without social support and services in older adults' neighborhoods, we're just keeping people in their houses, not their homes. They become isolated and imprisoned, not independent and healthy. So let's figure out how to bring them home. Systems need to respond. How did the system respond when neighborhoods were filled with young families with children? Did the system say, well, you all should just move closer to a school? No, we built schools, we built parks, we built soccer fields. If that's how we responded to the needs of young families, then why do we ignore providing essential services for older adults in those same neighborhoods? 5 years from now, we see older adults receiving the services they desire in their neighborhoods, and that there's a system of benefits that is paying for that support. We won't stop playing as we age, but older adults will be meaningfully engaged with the whole community, which has recognized then the advantages and the assets and the resources that our older adults can make possible in this place we call home. At the Health Trust, we think disruptive innovation is a critical strategy we should use to address the future needs of Silicon Valley. we pledge to continue expanding our innovations and developing new ones. Our back office accounting business has grown to over 60 clients and accounts now for more than $170 million. We plan to continue to grow this business. Who else gets to use the proceeds from its accounting department to supplement its budget? With the support of First 5 Santa Clara County and El Camino Hospital, we've provided over 100,000 patient visits in the past 5 years in our 2 dental centers. In the next 5 years, with our partners, we pledge to continue oral health education and open a 3rd dental center to complete the access needs of low-income children in need of a dental home. Currently, we serve about 70,000 hot meals a year to our Meals on Wheels clients. We pledge to double our number of meals served in the next 5 years by developing a social enterprise where we will sell healthy meals to the general public and return the profits to subsidize Meals on Wheels for low-income seniors. With the Affordable Care Act passing, ACA is being implemented now. We believe kind of 2 things probably will happen. Someone's going to make a lot of money by offering ACA new services. And secondly, the poor will probably not be able to fully access the benefits of the ACA. So we're calling together a task force to investigate and develop a one-stop shop using a partnership retail model to deliver all prevention services in one commercial setting while getting those services paid for by a variety of payment methods, such as health plans, the newly insured, or hospitals. We want to partner this concierge model of a suite of services where the people live or shop, and have begun preliminary work by opening our new health market at the Berryessa Flea Market. Hippocrates wrote, "Let thy food be thy medicine, and medicine be thy food." As we just saw in the video, we as a community have made remarkable progress in increasing fresh fruits and veggies to children and families. With our 12 Silicon Valley Health Corps partners, we have broken ground on increasing the supply of this vital medicine. Yet as we bring online our mobile produce fresh carts, small farmers markets, and remake corner stores in low-income neighborhoods, along with salad bars in the schools, we must be able to market all these new products. Kids now know that broccoli is good for them, and they're probably eating more, but they're still eating too much unhealthy food. So in conjunction with our CBO partners, this spring we will be launching the Good to Go Fast, Fun, and Fresh citywide branding campaign, because we want folks to make the healthy choice because it's easy, it's fast, and it's a fun choice. As we make great progress, we also know that too many vulnerable people still live by food sloughs, so they don't have adequate access to this vital medicine. Through our Destination Home public-private partnership and the release of the Economic Roundtable cost study this spring, we will finally have the tools as a community to end chronic homelessness in these next 5 years. With our partners, we will work together to tackle the end of homelessness in our county as well. If not here, then where? If not us, then who? We must continue to implement general plans such as San Jose's Envision 2040, including new partnerships with San Jose to place health fellows in city government to support the implementation. We must make sure that the next mayor of San Jose understands the health implications of all policy decisions, from zoning to wellness. And as we continue our commitment to chronic disease self-management and healthy early childhood development, let's also do a food action plan. In partnership with the city, First 5, the Packard Foundation, Second Harvest Food Bank, Public Health Department, and community-based organization, let's develop an action plan to identify the problems and over the next 5 years address the food insecurity issues of families, the homeless, children, and seniors. Because we're in Silicon Valley, what would a launch be without a website? So at midnight last night, I got a text, so I know it happened. At midnight last night, the Health Trust launched its website. It's a completely new website that our staff's been working on for the last couple of months to describe all the work that I'm talking about today. Please take some time in the next week to really check it out. Send us a note with all the bugs that you find in it. We need to have more local, relevant health information available to our communities. In partnership with our grantees and Create TV, we'll be producing a magazine-style show called Health Trust TV. Can't get to your doctor? We'll have a doctor from the Palo Alto Medical Foundation with health tips every show. We'll be doing cooking demonstrations using our Dining Out for Life chefs. We show what fun, healthy, low-cost activities are happening. Can't afford a personal trainer? We'll be being Ryan Hughes, is going to hear seen on the cover of the RX Fitness magazine. He's going to show us his latest workout and help you get in shape, and so much more. Plus, I knew you'd get reaction to that slide. Plus, each segment will be repurposed and sent out to all of our partners and grantees so that they can use all the segments to feed their social media and web communications to their constituencies. We know that so much of the great health work that's going on in the Valley is the best kept secret. So let's have a channel to get all this vital information out to the important constituencies that we serve. We reject this idea that some lives matter less. Dr. Paul Farmer will be here this spring. We'll be co-sponsoring his visit to the Santa Clara University. And I want to end really thinking about what his suggestion is. We at the Health Trust reject the notion that some lives matter less than others. And our talk isn't cheap. We pledge, with your support, to invest $80 million in these efforts over the next 5 years. We have our work cut out for us, but we are confident that with our staff, our grantees, the residents, our partners, we can and must make this the healthiest place in America for everyone. Thank you.